Hello, my name is Ray Libbert, and I'd like to welcome you to my fifth presentation, Social Innovation. In 1985, an Alberta doctor, Dr. Greg Powell, then working in Calgary, Alberta, was disturbed because the trauma death rate was 50% higher in the trauma center in Calgary than in other leading Canadian trauma centers. As Dr. Powell investigated the causes of the higher death rates in the trauma patients, he realized that because of the large area that is served by the trauma unit, the time that it was taking to get patients to the unit was the root of the problem. He then teamed up with the Lions Club, and soon the Lions Air Ambulance Service was formed. The name was soon changed to the Shock Trauma Air Rescue Society, or STARS as we know it today. The strategic plan of the Shock Trauma Air Rescue Society, in number one, is saving lives. And the desire to save lives has been their driving force since the 1985 start. To do this, they provide a means of travel while providing intensive care for the needed patients. And to do this, they have built 4 pillars of activity that allow them to be successful. The number one pillar is emergency medical communications. In 1996, it has become a 24-hour communication center that through their center, they link all the needed services together to get a fast response and correlate all emergency staff to give the quickest and best care possible. Then there's patient care and transportation. Through constant education for the air medical crews, which involves the paramedics and nurses that they have on staff, they can provide the best care possible. Also, they have an aviation crew, their pilots and engineers that can maintain and have their helicopters and their aircraft ready to go at a second's notice. And also now they have 7 helicopters that are ready to service that have been customized for emergency medical travel. Another area is their education and research. They have programs that they can help other emergency staff through rural and urban areas to better provide emergency care. And otherwise, the one we're most familiar with is the fundraising and community partnerships, which STARS Foundation is 75% funded by private donations and only 25% funded through a collaboration with Alberta Health Services. And most of this is done through the lottery and through calendars, which we're most successful with. STARS has now been in the skies protecting us for over 26 years. They've flown over 20,000 missions. Countless lives have been saved. 3 bases. It first started with just Calgary, then Edmonton. Now they've included Grand Prairie. Now these areas on this map you see here, that's just where they can fly without refueling, but they cover all places in Alberta and some in BC as well. They now have 7 helicopters to give us more service. And just a note, Dr. Greg Powell, who started STARS, he received the Order of Canada. So after their service for 26 years, can we say they've been successful? I would say they've been very successful. They've saved many lives. They blessed all of Alberta and some of British Columbia. I actually have a friend that broke his neck while water skiing in southern BC, just close to Alberta, and they were actually able to go get him there, so I'm very glad about that. And they're constantly changing and innovating to meeting the community needs. They have their education programs that help us constantly. Now, if I could contribute an innovation to STARS, it would be a smartphone app that can instantly send your present location to the STARS command center. So the emergency personnel that is needed for your situation at the time can be directed right to where you are as quick as possible. I'd now like to thank you for your time.